One tiny red spot. Most parents ignore it at first. Maybe it is a mosquito bite. Maybe an allergy. Maybe heat rash. Then the second spot appears. Then 10 more. By the next morning, the entire body is covered. The itching begins. The crying begins. The sleepless nights begin. And suddenly, a virus most people think of as normal childhood illness turns into complete chaos inside the home. Because chickenpox is not just uncomfortable. For many families, it becomes panic. Children scratch until they bleed. Parents use the wrong creams. Fever medicines make the condition worse. Skin becomes infected. Permanent scars form. And in some cases, a manageable viral illness becomes a serious medical emergency. Not because of the virus itself, but because of the way it was handled. Here is the problem. Most chickenpox advice online is either outdated, oversimplified, or dangerously incomplete. Some people try to dry the rash out aggressively and damage the skin barrier. Others suppress every fever immediately without understanding why fever exists. Many parents unknowingly give medications that research has linked to severe bacterial complications in chickenpox patients. And almost nobody explains what the body is actually trying to do during the infection. Because chickenpox is not simply a rash. It is a full immune battle happening across the skin, nervous system, lymphatic system, and bloodstream simultaneously. And the goal is not to fight the body. The goal is to support the immune system while reducing suffering and preventing complications. In this video, we are going to walk through the complete natural chickenpox management protocol backed by modern science and evidence-supported traditional remedies, what actually causes the unbearable itching. Why oatmeal baths work at the biochemical level. The antiviral plant researchers are now studying seriously the biggest mistake parents make with fever management, the exact day-by-day protocol that reduces suffering and scarring, and the warning signs that mean you need medical attention immediately. Stay until the end, because Part 8 may be the most important section in this entire video. That is where we reveal the 3 mistakes responsible for most chickenpox complications worldwide. To manage chickenpox correctly, you first need to understand what the virus is actually doing inside the body. Chickenpox is caused by the varicella zoster virus, a member of the herpes virus family. And like all herpes viruses, it does something unusual. Once it enters the body, it never fully leaves. After the illness ends, the virus becomes dormant inside nerve tissue where it can remain inactive for decades before potentially reactivating later in life as shingles. Now here is how the initial infection works. The virus usually enters through the respiratory tract, inhaled from cough droplets or exposure to fluid from chickenpox blisters. For several days, the virus quietly replicates inside the lymphatic system without obvious symptoms. Then it enters the bloodstream. This stage is called viremia. Once the virus spreads through the blood, it begins infecting skin cells across the body. And this is the critical thing most people misunderstand. The rash is not the disease itself. The rash is your immune system fighting the disease. Every red spot represents immune cells attacking virus-infected skin cells. Every blister is an inflammatory battlefield. The itching, swelling, heat, and fluid are signs of immune activation. That matters because many common approaches accidentally interfere with the very immune response responsible for resolving the infection. Now the rash typically appears in waves. New spots emerge while older ones begin crusting. This is why chickenpox patients often have multiple lesion stages visible at the same time. Red bumps, fluid-filled blisters, open sores, crusted scabs. A typical case may involve 200 to 500 lesions. And during this period, the skin barrier becomes highly vulnerable to bacterial invasion. This is why scratching is so dangerous. The majority of serious complications from chickenpox are not caused directly by the virus. They are caused by bacteria entering damaged skin. Understanding this changes everything about management. The goal is not aggressive suppression. The goal is controlled support. reduce suffering, protect the skin barrier, prevent bacterial infection, support hydration and nutrition, allow the immune system to complete the process. If there is one natural remedy that consistently helps chickenpox sufferers more than almost anything else, it is the colloidal oatmeal bath. And this is not just old folk medicine or internet advice passed around without evidence. Modern dermatology research actually explains why oatmeal works so effectively for inflamed, irritated skin conditions like chickenpox. Oats contain powerful anti-inflammatory compounds called avenanthramides. These compounds help calm irritation inside the skin and reduce the inflammatory signals responsible for the intense itching that makes chickenpox so miserable. Oats also contain beta-glucans, natural sugars that form a soothing protective layer over damaged skin. This layer helps lock in moisture, protect irritated areas from friction and air exposure, and reduce the dryness that makes itching even worse. In simple terms, oatmeal works like a calming biological shield for inflamed skin. And during chickenpox, that matters enormously, because the itching is not just uncomfortable, it is dangerous. Every time a child scratches a blister, the skin barrier breaks further. That increases the risk of permanent scarring, delayed healing, bleeding, and bacterial infection. Many of the scars adults carry from childhood chickenpox were not caused by the virus alone. They were caused by scratching during the healing process. Now here is how to prepare the oatmeal bath correctly. Take 1 cup of plain oats and blend them into a very fine powder until the texture resembles flour. Add the powder into a bathtub filled with lukewarm water. Not hot water. Hot water increases blood flow to the skin, which worsens inflammation and itching. Slightly cool or lukewarm water works best because it calms the skin instead of irritating it further. Allow the patient to soak for 15 to 20 minutes. During the worst itching phase, this can be done 2 to 3 times daily. And here is another critical detail many people get wrong. Do not rub the skin dry afterward. Pat the skin gently with a soft towel. Rubbing can tear fragile blisters open and increase irritation and infection risk. Many parents notice visible relief within minutes of the first oatmeal bath. Children often become calmer, scratch less, and sleep more comfortably afterward. And that matters because one of the hardest parts of chickenpox for families is exhaustion. Children lose sleep from itching. Parents lose sleep trying to comfort them. Reducing itch improves recovery for the entire household. But oatmeal is not the only natural remedy attracting scientific interest. There is another traditional treatment researchers are increasingly studying because of its antiviral, antibacterial, and anti-inflammatory properties. And that treatment is neem. For thousands of years, neem has been used in traditional medicine systems for viral skin illnesses. Long before modern laboratories existed, families in South Asia were using neem leaves during chickenpox outbreaks because they observed something important. People seemed to recover more comfortably. Modern science is now beginning to understand why. Neem contains biologically active compounds, including nimbidin, nimbin, and gadunin. Laboratory research has shown these compounds possess antiviral, antibacterial, and anti-inflammatory activity. That combination is extremely relevant in chickenpox. Remember, the biggest danger in chickenpox is often not the virus alone. It is secondary bacterial infection after scratching damages the skin. Neem appears to help on multiple levels simultaneously, reducing skin inflammation, lowering itch intensity, supporting skin healing, potentially reducing bacterial colonization on damaged skin. Now, it is important to be medically honest here. Neem is not a miracle cure. It does not replace medical care in severe cases. But as a supportive topical therapy, it has a surprisingly strong traditional history combined with biologically plausible mechanisms. Here is the safest practical approach. Boil fresh neem leaves in water for around 15 minutes. Allow the water to cool until lukewarm. Then use that water gently during bathing or apply with soft cloth compresses. Some families also use diluted neem oil, but it must always be diluted in a carrier oil like coconut oil. Never apply concentrated neem oil directly onto broken skin, and never put strong herbal oils on sensitive facial areas near the eyes. Now, alongside skin care, there is another factor that massively affects recovery speed and complication risk: nutrition. Because viral infections dramatically increase the body's nutritional demands, and most people underestimate how important that becomes during chickenpox recovery is heavily influenced by the condition of the immune system. And immune systems do not run on willpower. They run on nutrients, hydration, sleep, and energy availability. During infection, the body is operating at extremely high metabolic demand. Fever increases fluid loss. Immune cells consume enormous amounts of nutrients. Skin repair accelerates. Inflammation increases oxidative stress, which means nutritional support matters a lot. Vitamin A is one of the most important nutrients during chickenpox. It supports skin regeneration, epithelial repair, immune cell activity, mucosal barrier integrity. Foods naturally rich in vitamin A include eggs, butter, full-fat dairy, sweet potatoes. Zinc is another major player. Zinc supports wound healing, immune enzyme activity, and tissue repair. Low zinc status is associated with poorer immune performance across many infections. Good sources include eggs, meat broth, dairy, red meat. Vitamin C also becomes important because immune cells rapidly consume it during viral illness. Berries, kiwi, and citrus fruits can help, though acidic foods may irritate mouth sores if present. Now, hydration may be the single most overlooked factor of all. Children with fever lose water continuously through sweating and increased respiration. Even mild dehydration worsens fatigue, irritability, headache, and recovery quality. Coconut water can help because it provides electrolytes along with fluids. But plain water matters too. Small, frequent fluids throughout the day work better than forcing large amounts all at once. And here is something parents often need reassurance about. Appetite reduction during illness is normal. The body temporarily shifts energy toward immune function. Do not panic if food intake decreases temporarily. Focus more on hydration and nutrient density than forcing large meals. Now, beyond nutrition, there are several topical approaches that can dramatically reduce suffering during the peak itch phase. And some work far better than most people expect. One of the hardest parts of chickenpox is controlling the itch scratch cycle. Because once scratching starts, everything gets worse. More inflammation, more open skin, more bacterial risk, more scarring. Which means soothing the skin is not cosmetic. It is protective medicine. One of the simplest effective remedies is baking soda paste. Mix baking soda with small amounts of water until it forms a thick paste. Apply gently onto intensely itchy spots. The alkaline nature of baking soda appears to reduce irritation from inflammatory compounds sitting on the skin surface. Many people experience rapid temporary relief. Calamine lotion can also help significantly. And despite being considered old-fashioned, there is a reason it has survived for generations. The zinc oxide inside calamine reduces inflammation while helping dry lesions gently. That drying effect encourages faster crust formation, which helps shorten the contagious period and lowers the risk of blister rupture. Cool compresses are another underrated intervention. Cold reduces blood flow temporarily through vasoconstriction. That means fewer inflammatory chemicals reach the skin surface, which means less itching. Simple. Effective. Cheap. Coconut oil can become useful later during healing. Not during open oozing blister stages, but during crusting and healing phases. It helps moisturize recovering skin and may reduce scar formation. Now, this next section is critically important, because there is one area where many families accidentally make chickenpox much more dangerous. and that is fever management. Most people see fever as the enemy. Biologically, that is not true. Fever is one of the immune system's most powerful antiviral tools. Higher body temperatures slow viral replication and improve immune efficiency. Natural killer cell activity increases. Interferon production increases. Immune signaling becomes stronger. The body raises temperature deliberately because it improves survival against infection. Now, this does not mean every fever should be ignored. Extremely high fever or severe distress absolutely matters. But blindly suppressing every mild fever immediately is not always helpful. And there is one medication specifically associated with dangerous complications in chickenpox: ibuprofen. This is critically important. Multiple studies have linked ibuprofen use during chickenpox with severe secondary bacterial skin infections, including necrotizing fasciitis, sometimes called flesh-eating disease. The exact mechanism is still debated, but the association is serious enough that many medical guidelines advise avoiding ibuprofen entirely during active chickenpox infection. Aspirin is also absolutely contraindicated in children because of the risk of Reyes syndrome, a rare but potentially fatal condition affecting the liver and brain. If fever management becomes necessary, acetaminophen, paracetamol, is generally considered safer when used appropriately. But supportive cooling approaches should come first. Lightweight clothing, cool room temperature, hydration, lukewarm compresses. And this brings us to the most important section in the entire video, because the next 3 mistakes are responsible for the majority of serious chickenpox. Mistake number 1, allowing uncontrolled scratching. This is the biggest driver of scarring and infection. Scratching tears fragile skin open and introduces bacteria directly into wounds. Keep nails extremely short. Use mittens for young children if necessary. Prioritize itch control aggressively. Mistake number 2, using ibuprofen. Again, avoid it during active chickenpox unless specifically directed by a physician aware of the risks. Mistake number 3, overheating the patient. Many parents instinctively place sick children in hot rooms with heavy blankets. In chickenpox, this often worsens everything. Heat increases sweating, inflammation, itch intensity, and bacterial growth risk. The ideal environment is cool, ventilated, and breathable. Fresh airflow matters. Light cotton clothing matters. Skin comfort matters. And avoiding these 3 mistakes alone dramatically reduces complication risk for most. Natural supportive management is appropriate for many uncomplicated cases, but some situations require immediate professional medical evaluation. Seek urgent medical care if you notice difficulty breathing, chest pain, severe dehydration, persistent vomiting, fever above 40 degrees Celsius, fever returning after improving, severe headache with stiff neck, confusion or altered consciousness, rapidly worsening redness around blisters, dark purple or black skin changes, extreme lethargy. Adults, newborns, pregnant women, and immunocompromised individuals face higher complication risk and should receive medical guidance early. And never hesitate to seek professional care if your instincts tell you something is seriously wrong. That instinct matters. So let us bring everything together. The complete natural chickenpox protocol looks like this. During the eruption phase, oatmeal baths 2 to 3 times daily, cool room temperature, light clothing, calamine lotion. After bathing, excellent hydration, short fingernails, nutrient-dense foods, no ibuprofen, no aspirin. During the peak itch phase, continue oatmeal baths, neem water support, baking soda, paste for severe itching, cool compresses, nighttime scratch prevention. During healing, coconut oil for crusted areas, ongoing hydration, continued nutrition support, monitoring for infection. Warning signs. The reason this protocol works is simple. It works with the immune system instead of against it. The body already knows how to fight this virus. Your job is to reduce suffering, protect the skin, support recovery, and avoid the mistakes that create complications. And when managed properly, most people recover completely with lifelong immunity and minimal scarring. If this video helped you understand chickenpox differently, subscribe to the channel. Because every week, we break down the science behind viral illness, natural remedies, immune health, and evidence-based wellness without the fear, myths, or misinformation. And share this video with a parent who needs it before panic takes over. See you in the next video.